Naomi Oakes is an 11-year-old girl from Arizona, and she has a form of leukemia that she refers to as bad blood. And she calls it that because her favorite artist is Taylor Swift, and that's Taylor Swift's new single. So Naomi's family is having a difficult time affording all of her medical bills because she needs to be in the hospital constantly, and we know how expensive healthcare is in the U.S., and even if you're covered, it's impossible to keep up in a situation like this. So, guess who stepped up to the plate to help out here? None other than Taylor Swift. So she stumbled across a YouTube video of the girl, and she donated $50,000 to help pay for the medical bills. And she wrote the girl the following, quote, "To the beautiful and brave Naomi, I'm sorry you have to miss my concert, but there will always be more concerts. Let's focus on getting you feeling better. I'm sending the biggest hugs to you and your family." So naturally, when Naomi saw that Taylor Swift wrote to her, she posted a YouTube video and she said, "I can barely breathe. I seriously think I'm going to pass out right now." She was ecstatic that her favorite singer responded to her, and that she was so generous and kind to do something like donate $50,000 to help out. And Taylor Swift is actually kind of known for her random acts of kindness as well. I mean, clearly she's known because of what she does for a living, but she's done this a lot, is my point. So she helped a fan pay for her student loans one time, and she also helped a firefighter who was going through some trouble, among other things. I mean, the list goes on and on as to all the good things that she's done. But here's the angle to the story that nobody's really talking about, but I think everybody should talk about, which is we shouldn't have to rely on the kindness of Superwoman Taylor Swift to come save the day. So we have this gigantic systemic flaw that we're dealing with in the American healthcare system and in the health insurance system. And we just kind of accept it. And then you need good people like Taylor Swift to come in and say, okay, I'm going to help you with what you're going through. Well, how many, Naomi Oakes are out there who have leukemia and, they're a fan of some other artist, and the artist never hears the message, and that artist can't help, and then they go bankrupt because of their medical bills. I mean, how many instances of that are there in America? And the answer is way too many. I mean, medical bills are the number one cause of bankruptcy in the United States of America. Medical bills. Now compare that to other modern nations. How many medical bankruptcies a year does Canada have? 0. What? It's the number one cause of bankruptcy here. There, 0. Donut. Nothing. All right, well, how about Sweden? 0. Britain? 0. France? 0. Norway? 0. Denmark? 0. Iceland? 0. Australia? 0. United States? Number one cause of bankruptcy. Why should anybody have to pay out of their own pocket hundreds of thousands of dollars, if not in some cases millions of dollars, for some treatment when they're sick? There's a line in the movie John Q where one of the parts where Denzel's like fed up and he starts saying, "Sick, help. When you're sick, you should get help." It's that simple. But here in the U.S., to a certain extent, we go, okay, sick, help, maybe just to stabilize you, then we'll kick you out the door. But we'll do sick, help, and you go bankrupt if you can't afford it, which, again, nobody can afford it. Even if they have coverage, sometimes you go bankrupt in America if you get sick, if you have a certain kind of illness or problem that requires extended medical attention. We can't deal with this anymore, man. And again, look, we took a giant step in the right direction with Obamacare, without question. Our healthcare system was basically a joke beforehand. Afterwards, we gotten a little bit better. We've gotten 10% better. But we're nowhere near the finish line, man. The finish line is Medicare for all. The finish line is a single-payer system. I've told this story before, but if somebody gets pregnant in the UK, there was a great story about this a few years back. Like, somebody was pregnant, they delivered the baby. When they left, Not only was the bill $0.00 because it's paid for via tax dollars, they were asked by the hospital, oh, do you need money for transportation to get home? So understand this correctly. The whole process of going to the hospital, having a baby, then you leave, they made money. They made money. In the U.S., it's the exact opposite. Now, of course, in the U.S., you have the Republican politicians like, well, then you're going to incentivize people to have babies to make $15.37. We can't have that. Leave the peanut gallery alone here for a second. But the idea is, the basic principle that we're working with here in other modern nations is, this is something that's off the table. Okay? This is what real morality is. This is what a real system is that makes sense. When you get sick, you get help, and that's what the tax dollars fund. I ask you, if you're creating a system from scratch, what would be the first thing you decide, okay, we're going to have a government, it's just a matter of how big the government should be. Let's make a list of the things that should be funded by tax dollars and other things obviously shouldn't. You leave that to the private sector, whatever. But what's on that list? What's like the top 10 things, top 10 industries or whatever that you would pick where you say, okay, let's subsidize that one fully because that makes sense? Number one on my list would be healthcare. Number one on my list. You know, and then you also, education's up there, defense of the nation, infrastructure, things like that. But number one is healthcare. You get sick, you get help. But here in America, our priorities are all fucked up. And we live in a country where Naomi Oakes, 11-year-old with cancer, has to rely on Taylor Swift to help her. Taylor Swift's kindness. Meanwhile, how much money do we spend on the military every year? In fact, we know what it is. Why don't we show this chart here again? Yeah, I do think we can afford to pay for all the little kids with cancer. I do think we can afford to pay for everybody's treatment with cancer. We spend 57% of our discretionary budget on the military. And it's not like we need to do that because there's some existential threat that's spending almost the same amount on military. Let's look at the next chart. Oh, come on, man. Come on. We spend more than virtually every other nation combined, every other nation that comes close to us combined. So China, Russia, UK, France, Japan, India, Saudi Arabia, Germany. I mean, look, you see it right there. We could cut our military spending in half, still have the biggest military in the world, and then take all that money and redirect it to try to do Medicare for all. And all we have to do some other little cuts and tweaks around the edges. You know, get rid of all the tax loopholes with all the corporations that hide shit overseas. Bring that money back home, put it towards a healthcare system. And some pork barrel projects, put that money towards a healthcare system. And corporate welfare for the big banks, put that money towards a healthcare system. We could easily fund it. We just don't want to do it because the politicians are detached from the actual struggling happening right now amongst the people. So while the story is positive because Naomi Oakes got help from Taylor Swift, and Taylor Swift is an amazing person for doing this, and it's a great story, but understand that there's a massive downside to this story, which is that we have to rely on the kindness of Taylor Swift for kids with cancer to get help and their families not go bankrupt. We can change those priorities. We have to change those priorities. If we don't change those priorities, we're just not as intelligent as the other modern nations, and we don't have our shit together nearly as much. It's that simple.